And Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is both the lower wisdom teeth and their association with the inferior alveolar nerve. On the panoramic view, you can see that both the roots are very closely, look like they're very closely associated with the inferior alveolar nerve. And now we're going to take you to the lower right wisdom tooth first and show you on the transaxial view, which is basically the proximal view. Now, on the transaxial view, you will be able to appreciate this is the mesial portion of the wisdom tooth. And as we move distally, you can see that the apex of the lower right wisdom tooth is just on top of the inferior alveolar nerve, which is right here. As you can see right here, this is the inferior alveolar nerve, and this is the apex of the lower right wisdom tooth. As you move further distally, this is the interradicular area, and now this is the distal root, and it is very clearly visible as I remove the highlight of the nerve that this nerve portion is being compressed by the lower right wisdom tooth distal root. So it's very clearly visible. It quite significantly pushes it down, compresses it because it loses its circular architecture and then becomes a little kidney bean shaped right there. So this is the wisdom tooth, the inferior alveolar nerve and the distal root apex of the lower right wisdom tooth. Now this is the lower left wisdom tooth mesial root. As you can see, the mesial root is relatively far away, not as closely associated as the right side. But this is the distal root, and again, the distal root is in very close approximation. If we remove the highlight, you will be able to see. So this is the inferior alveolar nerve, and this is the distal root apex right there. So again, this is also very closely associated, and it very slightly compresses the inferior alveolar nerve canal. So the extraction or movement of the wisdom tooth can affect the nerve on both the sides, the right side more so and the left side as well. So this, we will categorize this as highly sensitive, as there is a risk of damage to the inferior alveolar nerve as a consequence of the extraction of these two wisdom teeth. This is the axial view. The axial view is basically the top to bottom view. Slightly zoom in so the doctors can see. And here again, just to give you an idea, these are the inferior alveolar nerve canals. This is the right side, this is the left side. Now, if you keep on looking at them and how they get closely associated with the nerve, you will be able to see with the tooth. And as we are moving inferiorly, both these canals get compressed by the distal roots of the inferior alveolar of the wisdom teeth, and also from the mesial root in the right hand side. Thank you very much.